Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really of a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hi there folks, my name's Phil Johnson. I live in Leicester, though I was born in London, St Mary's Hospital, Paddington actually. I spent most of my eventful youth in rugby, good old Tom Brown school days era, about 100 yards from the school, but never quite intended enough to get in it. I've been in Leicester since 1972. I don't know why, but I've always stayed here, and I'm very, very pleased that I have actually, because I think I've met the most stupendous team of surgeons and medical panel that anybody in my situation with a needed laryngectomy could possibly wish for. I am sitting here today like a bridegroom, so that I can try and explain to all you out there that may have or may think you have throat cancer or any other form of head and neck cancer, because they all come under the same branch. I don't mind sharing my experiences if I think it will help anybody in the future, anybody who may be worried about what they might be facing. Then please sit back, get 3 cups of coffee, 4 fags and a glass of whiskey and watch this video, because hopefully what I am about to tell you might do you a lot of good. The only way I can qualify that is that now I speak with a Servong, commonly known as the Dalek voice. I have been asked to go up on the Kingman's Ward Electoral Infirmary to speak to doubting Thomases who are facing laryngectomy operations, and even tracheotomy operations, and I've also been asked to address a class full of students at the Leicester University who are all training in various aspects of cancer and throat and head, neck, cheek, tongue, speech. That will be quite a challenge. So this is a good practice run. But I think, as I've explained in the video, if you've got this to come, do not worry. You have got a plenty of medical team behind you. All you need to do is knock in the brain box, and you go that way, they're positive. that way. They will help you every step of the way. And if you get frustrated, just simply make a few mud pies and chuck them in this video. That should amuse you. I wish you all well. And I'll tell you this now, you will come out the other side and you will be back to your old self. I hope you enjoy the video. Tatty bye. It's a very simple story, really. Me and my maid were sitting in the kitchen one day, and I got this great big worktop just about to put him up on the units, and I got a tremendous pain just behind me here, all the way down my neck, and it literally stabbed me. I sat on the floor and thought, what in God's name is this? And my mate looked at me, thought I was messing about. And it worried me. So, it continued. A couple of days later, so I went down to the doctors. They were brilliant. A virus. Bag of pills, off you go. 2 weeks later, not quite as bad. Same again. So I went back to the doctors. Same response. Go away, pills, virus. And I started looking on the internet and I thought, you know your own body. It doesn't matter how brilliant a medical man is, you know your own body. And I knew something was severely crap with mine. So I went on the internet, started digging about, and it took some digging, I'll tell you. But I thought, I better go back down to the doctors again, but I asked for another doctor, a young Indian gentleman, funnily enough. I paid him meeting in Delhi. Dr. Michael Nandakarma. I explained it all to him and I said to him, I know it's not a virus. As in, the way I know it's something serious, and I didn't tell him about the internet. I said, have a look on your computer screen, and you will see that I've been down here more in the last 2 months than I have in the last 10 years. Now he rummed in and looked in his book. He said, well, there is a nerve that runs all the way down here. I said, well, let's get it sorted out then, please. So he got me a 2-week emergency referral to ENT. And it doesn't matter how long that man lives or who he treats. To me, that is the best diagnosis of his life. And I mean that. He will go far because he had the audacity to listen to what the patient said. I went down to ENT. They had a poke and a scrape about with the old laryngoscope thing, which we'll come back to later. And they decided this Christmas Eve to take a biopsy. So they all had a nice Christmas dinner, and I sat there and watched them. Then January the 5th, 2010, they declared, yes, it is cancer, blah blah blah. Well, I already knew it was, but I hadn't mentioned anything to wife or family. Don't need them worrying unduly, do you? Because if you're wrong, you've caused them a load of unnecessary grief.
Had you attended on your own for that appointment then?
None of the hospital team came with me. Then the doctors and all that, and the internet. The funniest thing was, on Coronation Street, that damn time, Sally Webster had her little breast cancer scare and all, blah, 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 blah. And I sat in the chair thinking, well, you're not on your own, babe, so shut up. Leave it with you. But one said, told me I've got cancer in the throat. I knew they could sort it if it was the right one. They told me in a very matter-of-fact way. And believe you me, I responded in exactly the same way. There's no good crying about it, is there?
Well, everybody reacts differently, don't they?
And I just said to her, you saw my cancer out and I was all smoking man out. That's a fair deal. Because they're both as bad as each other. That is the new cancer in this country. Because economically it'll kill this country off. And so far it's cost this country 32 billion. And so what? It's all your money's being wasted, thrown down the drain, for what? Cancer cases are still rising. and smoking rates are falling. So there's something seriously wrong somewhere. But anyway, you don't want to know about that.
Well, that's interesting. It's
I went to see chemotherapy and radiotherapy department, Osborne building at the Royal. What was it, 18? Street art. Lovely fella, nice Indian fella. And I said to him, you kill me, I'll sue you. So we got off at a good foot in these all those areas. And I said, believe me, I will bloody well own you. Because I ain't ready to go yet. So we had a load of chemotherapy. The first lot had a very adverse effect. No bother about that. But I found the radiotherapy, a 33-day intensive course. To start with, it was a double. But the further it went, mentally the harder it became. And funny enough, I've just dealt with a gentleman from somewhere near Peterborough in Cambridgeshire on Facebook. He's just undergone the same thing with the mask. All strapped down, I'm going to be undrawn and quartered. And he was very worried about it. But once you get used to it, you've got to switch your mind off and just think, kill. Not me. That.
the cancer cells.
Exactly. But
Do you find there's a good forum online for meeting up with other patients? Or
yeah, we've created one.
You created one.
And of course I've created the 2020 Boys Cancer Appeal. Since that we got a lot of people now getting involved, it's taken time to lift off. We're still waiting for the 100 grand from the NHS, but I don't think that's coming. But never mind. But the actual radiotherapy being such a head-on sort of thing, you find that it drains you. I used to be dropped off and picked up by my son and my wife or whoever was available basically, because the car parking was absolutely bloody hopeless. But when I got home, the further we went down the line with the treatment, the more I just lay on the settee, totally zonked out. And the other thing, of course, because it's so intense, it literally flays you, takes all your skin off all around your neck. And it is a horrendous thing to go through, because as good as my good lady is, and my daughter, and gentle as they are, bless them both, when you know that your skin is peeling off you, it doesn't matter how gentle they are, it hurts like bloody hell. Change all the dressings, and when we ended up seeing her Italian, we had to go in the hospital every day to have them dressed and all treated, whatever that stuff was, liquid stuff, but aqueous and all that game put on it. But once it's finished, it does heal up fairly quickly, which is good, thank God for that.
Over what period of time?
I was in about 2 weeks. It seems hell of a time, but when you look back,
After the radiotherapy finished?
we went back to see 3-dar. And some more of those CT scans of prodding and poking, and he merrily declared the cancer had gone. I don't think so. It didn't feel right. Again, I'm not a medical man, but when you've got a couple of sponge here, and you can move it about from place to place, that's not right, is it? Even if you've had a shave, you shouldn't be able to do that.
So he declared it probably gone. It's, you know, you were in remission, he was saying.
The CT scan showed nothing. It said it's clear, it's gone. So of course we went yabba dabba doo, went down the pub.
And by that stage you'd had your chemotherapy and radiotherapy as well. Both.
Oh yes, the old come on gamut. So about, I think it was the end of October time, I asked to see Andy Moyer, chief consultant at the Royal. Lovely fella. He came from Birmingham, but I told him somebody had to, so he'd do. And I told him he job, but this is not right. How the hell can you start moving lumps of something about under your skin? And we had a partner both, and said, I think we better have you in a little bit confused. And he said, we'll have you in for a 10-minute
Exploration, yeah.
I can't say every word properly now. Yeah, one of them.
Have a look around, basically, see what was going on.
He said, don't worry, it's just a little small one under here to have a think about. So we went in on the 25th of October for this little exploration job.
Which year was that?
2010. 10-minute job, radio, 2.5 hours later, I woke up with scaffolding sticking out my neck. Oh my lord, what the bloody hell has happened here? And then you suddenly realise you got no voice. But up to then, although croaky, I could still babble on. I've always been good at babbling on. And I don't think it's a pain, a sound, a physical pain that gets you. It's a mental pain. But I remember laying there, one of the nurses, bless her, she's a lovely lady, but she's dead matter of fact. Fair play to her. I went up. And she went, don't start. You've had a tracheotomy. You've got a breathing pipe in your throat. There's nothing to worry about. I'll be back in 10 minutes. Now Richie was off. And now we're the only time in all this ordeal that has 60-year-old male. There were tears coming down my face. But I thought, how brutal is that?
Well, you'd gone into that operation not knowing what to expect. It was going to be something simple. It turned out to be quite complicated.
Oh yeah, well what happened? I went in one of the mini theatres, not the big major jobs, just for a little long sleep. And when they opened this up, Andy Moyer told me later that they couldn't find the windpipe, they couldn't find the food pipe. And I actually died on the table. Because they cut in, they've got to do this bit double quick to get your tracking tube in so you can still breathe. But apparently, good old CT scans, it happened to miss a bloody grey tumour the size of a golf ball that had punched me 2 pipes and 2 inches back to the back of my neck. Now that explains why I couldn't breathe properly, I couldn't eat properly, I couldn't sleep properly, I couldn't do a lot of things properly. See, it wasn't an empty tube, it was a golf ball.
But this is after the chemotherapy.
Oh yeah, this is when the CT scan said, oh, it's all gone, it's all clear. So it must have been a football before it started the chemo and then it shrunk into a golf ball. But bless it, Andy Moyer came a couple of days later. Gave me a writing pad and pen. And said, there's any questions, so I wrote down 1 man in an hour. Now, seriously, he explained to me, because he knows I like things bang up front. If that's what they are, that's what they are. He said to me, I honestly think, Phil, he said the best thing that can happen here is you have a couple of weeks in here recovering from this. He said then the whole lot's got to go. He said, because I do not like what I saw in there. He said, there is absolutely no way we can treat that apart from removing it. So that was Major John number 2. But he was basically saying, you've got 2 weeks to learn how to cope with no voice. Completely new world. Completely new me it is. And then we're going to finish the job off properly. The only thing that concerned me was if poor old Sridhar, bless him, and his CT scan and all his machinery, that hadn't spotted this. else hadn't they spotted. But Andy Moore said to me, look, we'll do the full apron. You know what, I've never really been a baker, but in medical terms, it's pull the whole lot up over your chin and literally scrape all the crap out. If it looks cancerous, dig it out. If it is cancerous, dig it out. If you think it might be, dig it out. So Andy Moore said we're going to take the lymph nodes out, the whole lot. I forgot where we got to.
Well, let's come on to this area where you'd had the operation, but you're waiting for another operation, this 2-week period. I think it was an interval, and basically this is the one where you were introduced to how to manage with the absence of speech straight away.
Well, in a way, NHS. The only introduction really was like one of those spiral wrap drawing things where you had some rubber tea if you could swallow. That was the major thing. The food, swallowing, absolute. No. Feeding beg. The horrible gunk was from up on my dripping into you. But I made my mind up. And no matter what happened, I was going to get the food tube elasticated again. So I used to have one Weetabix with loads of milk pushed up. It's like you'd feed a baby really. And then some Rice Krispies with loads of milk and literally a teaspoon at a time. Give us this romance, take an hour over a Weetabix. Stay with me, baby, till it happened.
Did you have to have any supplements or peg feed, they call it, in the stomach or anything like that?
Yeah, I had the peg in there. That's why I've now got the hernia. But that's just one of them incidental matters.
And I'm guessing around that time you were introduced to this speech and language therapist.
No. Good guess. Mr. Babbage went. We were concentrated on the big op. Because Andy Moore explained what would be happening. He said to me, in your case, you're looking at anything between 8 and 12 hours. I thought, well, that's half a bloody lifetime, that is. Gordon Bennett. But he was adamant that if they did as he wanted to do, the full apron, they would get everything, because he was convinced it hadn't gone down. Now if the cancer had gone down, there's no point doing anything, because you're not going to recover from that, are you? And there's no point going home for a few months and stringing it out with your family, playing happy families, when you know you're going to be beg out any day. So I just said yes, go for it, I don't care how long it takes. NHS will pay your overtime. Tread some serious mouth. It ended up taking 10.5 hours. And I felt like I'd been steamrolled. Believe you me, oh my God. And the picture wasn't very pretty. Funny enough, my daughter who's behind the car, she brought the camera, took some photos of me. Tubes and pipes and God knows what out of everywhere. I think the way they frame it out of it. I didn't know whether I'd done a number 1 or number 2 or any of that. It just happened and went into bottles and tubes. But the pain management was absolutely brilliant. And funny enough, the bloke I've just been to see another talk to about the laryngectomy last week, Duncan, he was worried to death about it, and I told him, you've got a trachea now. Believe you me, the morning you go in for your op, that is the day when all the crap finishes. This is the bad part. Those people look forward to the lariat thing. I've been there, and I'm still here. The trachea leading up to the actual big operation, that is the birth part, because it plays very well with your mental senses. It's only when you've sort of regained your compass mentis after the operation, and you know things are settling down. It's actually a sense of achievement to get out of bed and sit in the chair. I know that's stupid. For years up to lights, drips, machines, and God knows what.
There's a lot of steps involving getting back to your normal self from there.
Oh, and then some more. Whoever wrote 39 steps weren't far wrong. Double it. But once the drains and the drips are out, I know this sounds stupid, but once you can waddle off to the sink and actually have a wash and a shave and clean your teeth, and all the sweet Jesus, it stays like a new world. You feel like a new man. You. And it's only then that you really realise how alone you are. Because you can help but say this is something I've taught this my psycho lady about, because I did something very silly a few months later which will come back to just remind me about time.
Well, let's come on to this big issue about not being able to communicate, because a lot of people who are watching this, you know, will be wondering about that, and you know, maybe there'll be other patients in your position.
Prepare to be frightened to death.
Yeah, but obviously you don't know what to expect, do you, initially?
Right. Even while we were in hospital, the nurses on the Kidman's ward, all of them, male and female, they were absolutely brilliant. They had lots of little tips that are doing this annual. And we developed at home with my wife Tina and the kids a very simple code. 2 down is yes, or is good, or I'm happy, or what have you. 3, absolutely not, no, yet. And that passes for a lot of stuff when you got no voice. I've always been very, very good with the English language, with both speech and writing. Sounds big headed, doesn't it? But a lot of people, especially Larrys, have difficulty with pronunciation. But there is a major thing involved when you've got no voice, and that is enunciation. Now enunciation is learning to be able to speak, but without a voice. People, especially those that are trained in the art of enunciation and what have you, can easily read what you say. And I leave that on the camera because that bit's easy, what you are trying to say. The other thing it does, Alex, is the earphones. Is it teaches you to slow down your speech, which is slowing down is another major part which we'll come on to in a minute. But if you do slow down your speech, people have more chance of reading what you're trying to say. If you develop your own little signs or what have you, then they can fit in the signs with the facial expressions and the movement of the lips and even the tongue. I mean, everybody knows I don't like you, so that's easy. But when you come round to everything else, I would like a cup of tea, I would like a cup of coffee. Who got the biscuit? Who got the last bit? You two did. And Tina's hiding behind the lamp, so she wouldn't. And I tried to tell Duncan and the Kidmans last week that it doesn't matter how old you are, but I think he's about 342. If you can enunciate and do it slowly, then you've got more chance of people understanding. And the girls and boys on the Kidmans, they're very good. They were with every day, they're very good. And it gives you a great deal of confidence. I was in hospital for a month. And when I came out, I had got very little confidence for the outside world. It was almost like, because I'd relied on these people for so long, day in, day out, for everything I needed, that was my home. Sorry, team. That's how it felt.
You had to kind of learn and how to manage with this new condition that you had. You were recovering, but with these limitations, the changes to your abilities, your communication.
They are drastic. And I don't think it's till you get home, Alex, that you actually realise what a profound difference just losing this little bit, mate.
Did they help you on the ward to test out your abilities, to build you up a little bit?
Not overly much. They were more concerned in making sure I was possibly fit. I mean, all the mental stuff came later. With speech therapy and everything else after I left there. But, Cecilia. Anyway, she came up with physio and showed me some breathing tricks, because that's another major difference. Your blood is out, and that's all you've got, and that is your lifeline. And that takes some getting used to as well. Because when I got home, you'd laugh, but this is so stupid. I thought, I'm gonna have me a shower. Job done. That was me. And now I've bloody drowned myself, because I never even gave it a thought.
In a way, they should have warned you about that, I think.
To be honest with you, Alex, they probably did. But I found that with all the mental trauma you go through, taking everything in over a 4-week, 5-week period, that's thrown at you, third day you've lost your voice with a tracking, and then you're going to lose the whole bloody lot 2 weeks later. I think it does something to the head.
You mentioned about speaking to patients now who are facing this, but did you have that chance?
They said would I lie to, and I said no. I'm an independent little kid, I always have been, but I thought I would rather find out for myself. It was very nice of them to give me the choice, don't get me wrong. I suppose it was fear of the unknown. That's got to be a hell of a lot to do with it. I just thought, I've got complete faith in Andy Moyer, even though he just come from Birmingham, so that'll do for me.
Do you think in retrospect you probably would have benefited from that contact? Or watching something like this, or seeing having suitable information in advance?
I think having all the information in advance is a marvellous idea, because then it gives people the freedom of choice. If they do want to undergo and have a look, then they can watch the big silver screen. If they don't, and they only want certain bits of information, they can ask, rest in their head, go sleep, and wake up with an hole, and then battle it through their own way. Because the one thing I have learned, Larry's, I've always only got one similarity. Oh, throat. Every other aspect, every Larry is different. It's amazing, but it's true.
And your type of cancer was squamous cell carcinoma, wasn't it?
Squamous cell carcinoma, one ugly big of a cancer. I've got a photo of him on the internet. I actually asked Andy Moyer if he put him in a jar so I could take him home, but he said no. So I've got one on the internet so I can have a look at him.
Having gone through all this chemotherapy, the radiotherapy, and then the surgery, and then more surgery, how do you feel, how successful was the treatment overall?
What you've got to say in the first place, that the chemo and the radio was an absolute bloody disaster, and I wouldn't advocate anybody going through that, because I know what it did to me.
Although it might work for them.
Well, there's been a coin up then. There's patient who walks through the door, roll the dice. Why use it that? Because, as I said in some of the talks I have given to 2020, and they want me to do one at Leicester University soon for the speech therapy students.
Oh yes.
Cancer. Sounds right, doesn't it? Cancer. successful in terms of treatment.
Mm-hmm.
There are more survivors from our type of cancer, percentage-wise, than any other. But look at what we go through. You're welcome to a silent world, but once they've cut it out and got rid of it all, it's gone. Once they know for a fact that it hasn't gone below there, you know for a few years you're safe, till some other cancer comes along and bites you on the ass, which it surely will, because cancer cases are rising all the time, and that's probably because cancer is in all of us. It just takes a little nudge for it to evolve within us. Otherwise, why do some people get throat cancer? Why do they have brain cancer, prostate, bowel, breast cancer? We had a nephew. He's only in his 30s, bless him. A lovely lad. Life and soul of a party if he went out. He had a pain in his foot. Little black spot. Went to the doctors. 3 years later, he's gone up into his spine, cancer, and boom, gone. 34.
That's quite
Now you can't explain that, can you? If somebody were like 98, you think, okay, you've had a fair old innings. You smoked all your life, or you drank all your life, or you've been having sex with knowing the thousands of women have picked up a transmitted disease, or you've done something. But at 31 to 34, it doesn't make any sense.
So let's come on to talk about how the recovery went, when you were back home. And there's a lot going on there, I appreciate that. And, you had to learn a lot of new techniques. But what was happening emotionally at that time for you?
I think I can sum it up in one word. Destruction. Because although in your time at the hospital, you take in everything, the nurses, the doctors and the physiotherapists, the whole bloody gamut, you take it all in what they say, and it prepares you for how you are. God bless them, nothing prepares you for when you're out in that big wide world and you walk through your front door and think, I've survived, I'm home. Where do you go from there? That is the biggest problem, believe you me. I've got a very strong mind. I could turn my mind to virtually anything. But this nearly destroyed me. And I might as well tell you this now. Within a couple of weeks, I was feeling fitter, and like an idiot I fancied going in town. Big walk, no problem. I've got my mobile phone. Off we go. Within 20 minutes, half hour of walking around in town thinking I was knackered, absolutely knackered. And I thought, oh my lord, I better get a taxi home. Now don't forget my power of speech. It was a clipboard and a pen. And I wrote the number of my local taxi firm on the clipboard, and I wrote very clearly, please will you ring this number and get me a taxi. That was the most devastating thing in my life, virtually, emotionally. The looks and the treatment I got from people because I couldn't speak. And I thought one blow was going to run off with my phone.
Well, you realised, I suppose, in a way, your own limitations at that point.
I was defenceless. But that absolutely cracked me up. I ended up, I don't know where I got the energy from, but I walked right up the top of New Walk to near the train station when my daughter was working in the shop. I was in tears. She took one look at me horrified. I showed her and she went, oh my God, where have you been? So I rode down in town. She just rode down, idiot. And she was absolutely right. It wasn't until then I realised how nasty people could be. I mean, one bloke, he looked at me because I couldn't speak, because I went. And he just looked at me as an effing retard. Thought me. And then I realised that's when it really vulnerable I was and had something. I told him very strongly about vulnerability because that absolutely cracked me up.
What other reactions did you find over time?
Hibernation. I stayed in. I'm an isolated man, a recluse. I did go into Winston with Dina. Had half hours free, where I perhaps managed 2 or 3 shops. We found that me going to Astor or Morrison's was too much. In fact, I ended up in the bleeding mushroom store in Astor one day because I had a wibbly wobbly. The mushrooms all over the place and me sitting in the middle of them. They didn't charge me for any.
What about other people's reactions though? What other reactions did you get from the public over time? I mean, up to the current time.
But when I've got Dina with me or my son or my daughter, then they don't seem to make anything of it. It's just some silly old fool doddering about with his walking stick. But I found I can go into the bank. I can go to the bank in Winston on my own now because I can bar virtually outside. That they now know me in the bank.
Yes.
So, I suppose it's a bit like an immigrant coming into the country and trying to be accepted for what they are.
So initially it's difficult when you're not
Very.
there. But then if you go back to the same place a few times, they gradually get to know you.
I find the people in shops, banks, places like institution places, they accept your disability, what you are, who you are, a lot more easily than just Joe So wandered on down the street. But you also find, and this is something I've never done before, but you also find that you withdraw. I mean now, I don't know why it is. And my good lady, normally it's never been able to explain why, but when I hear somebody coming up behind me now, I instinctively curl up in a ball in the head, move to the side, and I'll quite happily stop until they've gone past, and some of the lungs get. But they don't understand.
What about this question of finding a role and activities for yourself that you're happy to do?
Oh, that's a novel.
You do your campaign type of things,
Oh,
fundraising, that kind of thing.
what happened was, when I thanked Andy Moyer for everything he'd done for me, he's obviously got all the cancer out and he's gone in the dustbin. I said, well, you've done all that for me, what can I do for you? And he pointed to this magazine and gave me one of them. It's a rhino laryngectomy thing. Come on, Lord. Old big mouth. Yeah, no problem, when you want it. That'll do me. 50 grand a time they are. So I thought, bloody hell, how on earth are we going to get 50 grand together? And then I talked to 2 other people. Sarah Harris, my speech therapist, Ross White, and B. Conboy, Mr. Tom. And they all told me that our type of cancer was very sparsely funded, shall we say. And then they had to buy for every penny. And I thought, well, hang on. This is an ideal opportunity where we're not particularly gathering funds to help one child who's terminally ill or one person who's on their way out, or somebody who needs an aeroplane ticket to bloody Punjabi Wabby for an operation. If we can buy equipment that can help all cancer patients, especially head and neck. And then the more I thought about it, and of course I asked my dearly beloved what she thought. And she said, maybe just keep it to head and neck cancer patients, because there is no other charity dealing specifically with equipment for such people.
Let me ask you something about this fundraising. I mean, it's really fantastic that you've done this, and obviously any funds, I'm sure, appreciated. But I'm just interested whether this is equipment or facilities that the NHS wouldn't otherwise provide. In other words, is it additional specialist facilities, or is it an issue that in this climate the NHS is not funded adequately anyway, so you have to top it up?
Basically, yes. I mean, they've got Robbie the Robot, as Beacon Boys named it, but they won't fund the extra scopes, the detachable ones. Now, to me, that is bloody ridiculous, because they know that things that go inside the body have to be absolutely spotless.
Sterilised.
Sterilised, and totally sterilised, so that they can actually go into another human body after that one. So why they won't waste 3 or 4 grand? Waste? How can it be a waste? On having 2 more extras, so they can actually turn over 3 times as many people. Because this brings me back to what I said earlier. Macmillan Cancer Board have now done a survey, and there are 889 new cancer cases every single day. There are throat cancers have increased by 600% in the last decade. That's true. So there's a fair chance that Leicester, being one of the major hospitals in the area, and it supports Northamptonshire, Derbyshire, Rutland, Nottinghamshire, Warwickshire, although some go to Birmingham, and Staffordshire. Now that is a hell of a lot of people. They've only got one, probably the robot, with 1 arm. That's a bit bloody stupid, because if those with Beacon Boy and his mob have, say, got 40 patients in a day. Now I know they're like Andy Moyer, they will stay until they've finished. They won't go at 5 o'clock, time to go home, bugger off, we'll see you all tomorrow, because they care that much about their patients. And the other side of it, Alex, of course, is you think of everything I went through. If we'd have had that camera available then, I'm not saying it would or it wouldn't, but it might have saved my voice. And to me, now I've had to learn how to cope to a whole new world without voice. If we can save anybody losing their larynx with the 2020 voice cancer bill, then to me it'll be worth every single moment of effort. I mean, Tina, one of our Larry's lovely lady called Kim Godfrey, I went to see her last year on the Kinglands. She'd had a laryngectomy and a glossectomy. Bless her, she'd lost most of her tongue. And I, like an idiot, waltzed in the room to see her with me cup of coffee. Never even given a thought. She told me the other day, I hated you the moment I saw you, that you could drink coffee, and I couldn't. Everything went in the bag. Now I've been through all this, but I never even thought of that. But Saturday, she held a rummy sale over in Loughborough. And God knows how much stuff they got there, and they've raised well over £1,000 for this. So they've contributed greatly towards another one of those scopes. It is a shame that the NHS is underfunded, but we don't want to get into the politics of the EU, Alex, so we'll change the subject on that bit.
Let's talk about the emotional side and how people cope in general, what you've observed and also what you've been through yourself. I'm sure there were low points in there and some bad days and some good days as well. But I mean, I guess from a viewer's point of view, somebody in that early phase is facing a lot of uncertainty and a lot of challenges that they haven't asked for. How can they navigate through that?
By a big boat. I think the only thing that you can do, but the only possible way you can do it, and I mean this sincerely, folks, that make sure it's positive and pointed forward all the time.
How can other people help with that?
yes, they can. Family support, when you come out of hospital, family support has literally got to carry on emotionally from where hospital support finishes. I mean, hospital support is good, the nurses are brilliant, male and female, but when you get home, it's vital that your family starts to learn, which I think they do very, very quickly, especially my beloved did, till I bleed in Florence Nightingale. But they quickly learn the changes that have happened to you. One of the biggest things is that your family can make it very simple so that you don't get frustrated. Because frustration, not being able to speak, is a terrible bleeding weapon, I'll tell you. You want to smash the walls down because I've got a cup of tea, babe, cheers. While you over it, you've got to get the communication going. Whether it's, like I said before, enunciation, or some people can use esophageal speech, or some people do actually have a couple of operations which I did and put a little noise valve in between the air pipe and the food pipe, and then they can learn. Except as you can see, I've had a couple of goes at it and it's failed. Okay, disappointed, big whoop, but I've got my feeding machine, my darling voice, say hello to the darling. I can make myself heard with this.
Did that take some learning to use that?
It did initially, Alex, because, again, frustration sets in. This hasn't worked, that hasn't worked, this is closed up, that's closed up. You're counting the days until you go and try the new voice valve. Like bleeding Ted Rogers and Dusty Bin. But then when you get there and find out it's closed up and it hasn't worked, I mean mine closed up in 20 seconds flat. I was absolutely mortified. And Sarah, bless her, these therapists, she went, I'll try this true tone. I said, well, we tried that last year, but the radiotherapy made everything under each end like concrete. So it was like total despair. And there's a bone. I won't tell you what the word was, but it's commonly used in medical and legal services. It is right a load of rubbish. So I just... and I couldn't believe it. Over time, this had softened up enough to allow the vibrations to make this work.
Now, how do you feel, going back to what we were saying before about other people's reactions, how do they respond to your voice with the communicator?
Mostly I'd say very well. I have had to speak a bit slower so that they can catch on and comprehend everything I say. And I've even managed to have telephone conversations with this, which is quite nice, especially when you get these idiots ringing up from these call centres. When they say, who are you? I say, I am a Dalek, and if you don't piss off, I will exterminate them. They soon go. So there's a bonus.
There's always positives, aren't there, to say?
There is always a positive, Alex, and I'm glad you said that, because to all my adoring fans out there, all future Larrys, you have got to stay positive, for God's sake, and don't get in the frame of mind. It's going to happen. Because if you sink inside and let this die, the rest of it will follow.
Speaking of which, is there anything that you feel you can't do now that you'd like to do?
Oh yes. Absolutely no end stuff.
So there are things you're restricted from.
Because
Are there certain things that are advisory, because of the changes there, that you can't really do it? Swimming, for example.
I can't go swimming.
Yeah, but anything like that.
A DIY. I can't go out and fit a kitchen. I've raised my art.
Because that was your profession, wasn't
Oh,
it?
I loved it. You create something nice and new.
You can't do that, not just because of the fatigue.
I'd have. I run out of breath. I mean, now, but I've got COPD as well. And his brother, emphysema.
Yes.
She ain't very pretty, emphysema. Not even in the bowl with our dress. slowed me right down. And I found that with this, and some of the other Larrys have as well, that the more operations you have round here, then the more it affects the chest area.
Sure.
And I think both physically and emotionally, one of the hardest things I've had to come to terms with, and I still haven't completely managed it. The body has slowed down considerably, and now you have to use the walking stick because the radiotherapy blew me balance out the window. But unfortunately, this thing in here is still 21 and still thinks it can do what it did when it was 21.
Well, what about things that you can do?
I do them very slowly. I have to take frequent breaks. I have to rely on my nebulizer because when I get chest infections, oh dear, it's not good. I am usually resident of NHS for a few days while they sort me out with antibiotics and what have you. But again, you see, Alex, you have to learn to know your condition and learn to cope with it.
Sure.
It might be very bloody hard at times because you think, oh my lord, not again. But you have to.
So looking at the big picture, which is how everything's evolved and where you are now compared to where you were before you started, but you had those symptoms building up. You weren't sure what they were, and you went through all this process. Now, somebody who's watching this could be in that very early stages, and they might be thinking to themselves, "Wow, there's a lot of challenges. There's a lot of problems to face. Is it worth it? Is it worth going through it?"
Well, if you got Gerber Tenzing's phone number, get him. These little memories. That's what it's like.
What would you comment on your quality of life now? How things are now compared to
Funny enough, they did a little survey in speech therapy about this, and I was amazed to find out that independently and individually, most Larrys nominated about 35%, 40%. But you see, it's so easy to think back to what you could do.
What do you mean nominated 35%?
Quality of life.
That it was 35% of what it was?
Absolutely. But
Well, that's interesting because, where you're missing that 2/3, it's easy to concentrate on just that 2/3 that you're missing rather than what you have, isn't it?
and that is the problem. That is what you've got to get over in your mind. And that's why you have nutty people like this come and see you, because they help you get through that.
Part of the psycho-oncology.
Oh yes, you need that without a shadow of a doubt.
But that's not always available everywhere.
Well, it bloody well ought to be then. Because I think my mind is essential. I mean, she don't even make the tea when she comes round our house. How essential is that? She's useless.
But looking at what you can do is a key strategy, isn't it? Rather than what you can't do.
Yeah, if you start looking at, oh my god, I used to be able to do this, I used to be able to do that and do the other, then you're looking at all the negatives. Whatever you do, as soon as you get on this journey, it's like the old Chinese proverb, even the journey of 1,000 miles starts with a single step, and that's the single step which is most important. B, the positivity. Think of a battery, not the negative, only the positive.
I think that's good advice. What else would you say to people watching this for the first time? Maybe patients or relatives who are seeing what you've been through.
Don't panic, Captain Mainwaring. Whatever you do, don't panic. Obviously cancer, the very word itself, unless you're a bloody crab, is a very frightening thing to deal with. But I think, if you're feeling symptoms, I can only speak from head and neck, obviously. I don't know what happens around the body. But if you do get symptoms, do not be afraid to go down there and see your doctor and say, oi, bongo Billy. I think this is a bit more serious than a bloody cold or some silly virus. Why am I getting this pain? Amplify it. You make sure that you get your 2-week emergency appointment. And if it turns out to be nothing, I applaud you. So bloody what? But if it turns out to be something, now we've got this new technology. with the rhino-laryngoscope, videoscopes and all this game, you could be the one person that gets their backside down the Royal, Peacock Royal, Mr. Top, and shove that tube in. We've got him early. You could be that one person, the first of millions, that doesn't lose their voice, doesn't go through all the that I and many others have been through. So, never be afraid to go to your doctor and say, listen you, forget viruses, I want this checked out.
Where do you see the future going for yourself?
A wooden box. But we all die sometime, don't we? Seriously. I've now almost learned to cope with what I've got now. I mean, I've got my trusty mate, Mr. Walking Stick. I've got my delightful wife, beautiful woman, and my 2 kids, who are a complete pain in the arse at times, but they're both lovely. They all understand the condition, and we know how far we can go. Tuesday Market Harbour, I'm worn out by then. But then, the human brain is a marvellous, marvellous bit of kit, because of the learning capabilities, and I think as you call it, the readjusting capabilities are phenomenal. I mean, I don't think they can cover now, and then absolute dumb, whip him off, do this, do that, do the other, then the sensible part takes over and goes, shut up idiot, you need help. Because I know now I couldn't lift that cupboard up and fit it on the wall, and if I tried to take it off, I'd probably bloody fall off and break my stupid neck. So, now, we get my respiratory situation under control. Chris Collins got me brain under control. The boss, riding round the corner, the good lady wife, she's got my day-to-day living under control. I'm starting to feel that I control this. This don't control me. I can open the door. You're gone. I don't need you anymore. I know what you've done to me. I know how you've left me. But say, love yours, I'm still here.
Well, you've got that ability to, like you say, be in control of things back, because in that early hospital phase, it's quite extreme. You're just, everything's being done to you. You're very passive in that situation.
Oh yes, you're not a ragdoll. You think Frankie Valley and his band were singing to you.
And you got back that control, but yet you still value the input of others. You still value the help you're getting.
Absolutely.
But you've got your somewhat independence yourself, and more than that, the ability to control and communicate in a way that's meaningful for you.
Absolutely. I mean, the amount of people I can nominate who've helped me along this extremely rocky path, they're innumerable. And from where we started, the emotional side of it, and it's family, and it's nutty people like Chris, it's speech therapists like Sarah, and even when you go back to ENT to see one of the consultants, you know that the cancer's been removed, because remember we've had the apron and the paint scraper in there, and all they do is quick check, and they fill you full of happiness because no, there's a film, can't feel anything there, a little bit bouncy, all feels more what it's healing, how you doing with this, how you doing with that, blah, 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 blah. And you, although you lose so much capacity for what you used to be able to do, up here, you know that you're so much stronger, because you know you can virtually cope with it. I mean, obviously going back to when that day I went in town, that was an idiotic thing to do in retrospect, so I'd never do it again, and I wouldn't advise anybody else to do it. But believe me, all you Larry patients, future and past and whatever you will all have done something stupid, you will all do something stupid. It is the biggest learning curve of your life, but you've got to be positive and cope with that curve, because at the end of it, that is your life. Stick with it.
Let me just say for the audience watching and for myself and the people here as well. Thanks for coming in today and sharing your story.
Not a problem, Alex, anytime.
There's a lot of valuable information in what you've said, and even where you faced a challenge, you know, maybe like you say, it hasn't always gone well. You've learned something from that. You've faced that fear, you've pushed yourself, and then you've learned what you can and can't do.
I'm afraid you have to. I mean, I went to visit somebody one day, knocked on the door. This was not long after all the ujjibby. They weren't in. They got mixed up onto where they thought they were meeting me. And I've ended up just stood by the back door, absolutely destroyed. I was in tears. I just couldn't understand why they weren't there. And when they pulled up in the car, they were, what's the matter?
It's a simple thing, but it can cause a big problem.
Oh, hell of a problem. I mean, you can be as strong as a bloody ox, but emotionally sometimes it just crumbles.
Well, you know, you're aware of your vulnerability, aren't you, in that situation?
I am now, and I know now, especially without that and that incident in town, Alex, just how vulnerable people with no voice are. I've been just saying, somebody hit me on the head and this and that. At the end of my going to hell for help. I can't. If I lay there going, somebody's gonna think I'm a bitch. Sorry, drunk. Or having a bloody fit. No one's gonna hear it. And that's why that's a great cause of your seclusion, staying at home, and only going out with family members or trusted friends. But it's right to have to stay positive, because that is the only way you'll cope with it.
I wish you all the best for the future. Take care.
I do you as well, and it's good luck to me, old man.